Hello everyone. Today, we're diving into the world of a medication called Tildrakizumab, commonly known by its brand name, Ilumya. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Tildrakizumab, often recognized by its brand name Ilumya, is a biologic medication used for the treatment of moderate to severe plaque psoriasis in adults who are candidates for systemic therapy or phototherapy. Ilumya is a humanized IgG1/K monoclonal antibody that selectively binds to the P19 subunit of interleukin-23, IL-23, a cytokine involved in inflammatory and immune responses. By inhibiting IL-23, Ilumya helps to reduce inflammation and the overproduction of skin cells that leads to the formation of plaques. Approved by the FDA in 2018, Ilumya is administered via subcutaneous injection and is typically given once every 12 weeks after initial loading doses at weeks 0 and 4. Warnings: Ilumya comes with its set of precautions. It is essential to be aware of potential allergic reactions, including serious hypersensitivity reactions. Before starting Ilumya, you should be evaluated for tuberculosis, TB, infection and monitored for signs and symptoms of active TB during and after treatment. Since Ilumya can affect the immune system, it may increase the risk of infections. It is not recommended for use in patients with active infections, including clinically important localized infections. Before taking this medicine. Before starting Tildrakizumab, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug or if you have a history of infections. If you have a history of tuberculosis, live in an area where TB is common, or have been in close contact with someone who has TB, this should be communicated to your doctor. If you have recently received or are scheduled to receive a vaccine, inform your healthcare provider, as live vaccines should not be given concurrently with Ilumya. Patients with a history of inflammatory bowel disease should use Ilumya with caution, as cases of new or worsening inflammatory bowel disease have been reported. Side effects: all medications can have side effects, and Ilumya is no exception. Common side effects include upper respiratory infections, injection site reactions, and diarrhea. Serious side effects can include severe allergic reactions, infections, and exacerbation of Crohn's disease. If you experience any symptoms of serious infection, such as fever, chills, muscle aches, cough, or shortness of breath, it is crucial to seek medical attention immediately. Other potential side effects include headache, joint pain, and fatigue. Always consult your doctor for medical advice about side effects and report any new or unusual symptoms. Interactions: Tildrakizumab might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Specifically, live vaccines should not be administered while using Ilumya, as they may cause serious infections. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Ilumya. The typical dosing regimen involves an initial dose of 100 mg administered subcutaneously at week 0, followed by another 100 mg dose at week 4, and then 100 mg every 12 weeks thereafter. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. Never alter your dosage without consulting your healthcare provider. Avoid: while on Tildrakizumab, avoid receiving live vaccines. It's also advisable to stay informed about any signs of infection and report them promptly to your healthcare provider. Given the potential for dizziness or fatigue, be cautious when engaging in activities that require alertness until you know how the medication affects you. FAQ: many wonder about the age restrictions for Ilumya. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of Tildrakizumab, known as Ilumya. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.